meaning of earliest and all in temporal conditions, demonstrated in a two-condition line cohort. A question was asked in class. What is the difference between having earliest on the condition lines or having all on the condition lines and having earliest only on the index event line? We will now work an example that will make this distinction clear. For people who wish to get deeper insight in cohorts, read Riddles in Accountable Healthcare by Eran Bellin, available on Amazon in either paperback or Kindle. Let's understand all and earliest in a two-condition line cohort. First, our question. Ultimately, we're going to want to find patients who are discharged from the hospital with asthma, and we're going to want to find patients who are discharged. First, our question. Ultimately, we are going to want to find patients who were discharged from the hospital with asthma and then readmitted within 0 to 30 days with asthma. Let's take a look at the cohort structure. Condition line number 1 is earliest discharge of asthma. Condition line 2, earliest of admissions with asthma 0 to 30 days after condition line 1. And the index event line is earliest of condition line 2. Let's do a schematic for the two condition lines used to qualify a patient named George. George's discharge experience are going to be cartooned on the right of the condition line. Here you see the discharges George experiences in the calendar time. Remember the cohort structure. Condition line 2 is earliest of admissions with asthma within 0 to 30 days after the events in condition line 1. Line 1 is earliest of discharges with asthma, and the index event line points to condition line 2. So here you have the discharges in a cartoon, and paralleling on condition line 2 are the subsequent admissions. Now let's create a scenario where there are admissions and discharges, but some without asthma are red. They're non-qualifying events. Now let's create a scenario where there are admissions and discharges, but some are without asthma. They're labeled red and are considered non-qualifying events. So the legend, red means an inpatient hospitalization without asthma. Green means an inpatient hospitalization with asthma. In line 1, we're dealing with discharges, so the legend means red, inpatient discharge without asthma. Green, inpatient discharge with asthma. Line 2, we're dealing with admissions, so the meaning of the legend is red, inpatient admission without asthma. Green, inpatient admission with asthma. Now, as you can see, the first discharge in the cartoon representing condition line 1 is red, so it was non-qualifying. The first admission in condition line 2 is without asthma and also non-qualifying. Now we're going to add, in terms of time, a notion of earliest. And we're also going to add earliest notion for condition line 2. So does George qualify for inclusion? Well, let's number the events. Event number 1 didn't qualify for earliest discharge with asthma. Event number 2 does qualify. So it would be event number 2 representing condition line 1. In condition line 2, we have earliest as well, so number 6 does not qualify, but number 7 does. So we have potentially a hospital discharge, number 2, and a hospital admission, number 7, who could potentially qualify George for inclusion in the cohort. 2 and 7. But is George qualified? Once again, we're selecting earliest, so it's earliest with asthma number 2, earliest with asthma number 7. But it really doesn't, does it? Why? Have you forgotten something? To qualify, doesn't there have to be a temporal distance of 0 to 30 days between event number 2 in line 1 and event number 7 in line 2? If this temporal requirement is not met, then George is disqualified. The earliest requirement on both lines only permits consideration of one event from condition line 1 and one event from condition line 2. If the temporal constraint in this one pair is not met, George is disqualified. Consider now another cohort condition line time option, where instead of earliest you have all. Now 2, 3, 4, 5 all qualify from condition line 1, and 7, 8, 9 all qualify from condition line 2. And your comparisons to establish the 0 to 30 days for the readmission are 2 to 7, 2 to 8, 2 to 9, 3 to 7, 3 to 8, 3 to 9, 4 to 8, 4 to 9, 5 to 9. So you have many more possible temporal comparisons that could qualify a patient for inclusion in the cohort. If the original 2 to 7 didn't qualify, but 3 to 8 did, the patient would be qualified. Now, any of these comparisons could meet the temporal requirement that event in condition line 2 is 0 to 30 days after event in line 1. If more than one of these pairs meets that criteria, then the index event line, if it's set to time equal earliest, will pick the earliest pair, or if it's latest, we'll pick the latest pair. As you can see, it makes a big difference whether you have all in your condition lines or earliest in your condition lines. Additional readings may be performed. Additional readings can be found in Riddles in Accountable Healthcare, a primer to develop analytic intuition for medical homes and population health, published by Amazon in paperback,